Yeah, there are. Okay, so we're going to get started. I'm going to load your slides, and you'll just tell me when to advance them. Okay?
Okay.
So, everybody, my name is Harlan
Sorry, everybody.
Kilstein, and I am the top dog at the Dogington Post. I'd like to welcome you to Dogington University, which is generously brought to you by the Dogington Post and Merrick Pet Care. Merrick Pet Care is a leader in the real pet food revolution. It's offering a wide variety of dry and wet dog and cat foods that are available nationally at independent pet specialty stores. Is your dog's food worthy of a fork? Merrick recipes are made with USDA inspected deboned meat as the first ingredient and the freshest produce. It's health you can see in your dog's bowl and, more importantly, in your dog. To learn more or join the Merrick Real Food Revolution, please visit Merrick Pet Care on Facebook at facebook.com/Merrick Pet Care. Now, today we are really excited to kick off some educational power to the paw with the first of 8 live online dog training seminars from some of the top trainers in the world. They will share ideas, hints, secrets, and tricks, bringing out the best in your dog, many with a Q&A session to ask your toughest training questions. Please note, at the end of each webinar, one lucky winner, the first person to correctly answer a question based on our presenter, will receive a free voucher for a 25-pound bag of Merrick's Real Texas Beef grain-free dry dog food. That's a $60 value. Plus, that's the latest food that's been added to Merrick's grain-free lineup. And additionally, our friends at Merrick are going to donate a bag in the lucky winner's honor to our friends at the National Mill Dog Rescue, one of our good Dogington University partners. So here we go, and we're going to get started. How to save money, time, heartache, and even your dog's life through better training. Now, we're starting with an alert. Chris, Dr. Smith, the other day we were talking, and you told me something that was absolutely shocking and that could save some fur baby's life. So could you explain this to our folks, and then we will take questions about this at the end.
Okay. One of the things that I've been seeing recently as an emergency veterinarian is increasing number of cases of people giving antihistamines to their dogs that contain a nasal decongestant, which can be very toxic and even lethal to some dogs. We had a small Shih Tzu in the other day that was given an adult Claritin D, and he was in really bad shape. His heart rate was very high, blood pressure was very high. We were worried about things like retinal detachment, bleeding in the eyes, things like that. And with proper treatment, he was okay. But one of the things is that antihistamines are given to dogs all the time. Veterinarians recommend antihistamines to dogs, and actually they are very
Why
safe.
would they recommend an antihistamine? Under what circumstances?
Dogs with allergies typically get skin problems, and when they are environmental allergies, like to pollens, molds, things in the house, that type of allergy will sometimes respond to antihistamines. But it's kind of like people. You know, when we have allergies and we take an antihistamine, it takes the edge off, but it often doesn't cure the problem. Food allergies don't respond to antihistamines, and you know that's why you want to feed a good diet. But so often we'll recommend Benadryl and these types of antihistamines, but sometimes people will go to the store, purchase what they think is just the plain antihistamine, say diphenhydramine, for example, but more and more of them have a decongestant in there, and that is what can be toxic. So antihistamines in general are okay, but be absolutely sure you're not giving anything with a D afterwards, Claritin D, Tavis D, you know, all those types of things. So that's just something that you and I were talking about, and it's something I've seen several cases of recently, and people need to be aware of that.
Okay, so let's go over this. The dog is suffering from some skin issue, and they go to their vet, and their vet says, give them an antihistamine. And
they'll usually tell them, you know, what to use and how much strength-wise.
Okay, and that's not a problem, right?
Correct.
Okay, So
But when
the
they
next,
go to the store, they'll see there's so many varieties of antihistamines on the shelf that it can be very confusing as to choosing the right one. So that's where the issue is.
okay, so now dog parents are making an unknowing mistake. Again,
Correct.
I'm repeating this because it's just so important. If we could save even a single fur baby's life, it's worth it. So you
Exactly.
told me on the phone that Tavis is okay, but
Right.
Tavis D would not be okay. Is that correct?
That's correct.
Okay. And
That,
that's because D stands for decongestant, and that can cause
decongestant.
any number of problems.
Exactly.
Okay. So, folks, we're going to be publishing an article about this in a while, letting you know. But decongestants and your fur babies absolutely do not mix. We're on the next slide. Um, we're seeing a dog, and he's running in the middle of the road. Um, Talk to us about this situation. How often do you see problems like this?
Almost every week. I work mostly nights and weekends because I'm an emergency vet, and almost every weekend we have at least one dog, sometimes two or three in a day, that will come in that are hit by cars, and it's heartbreaking. You know, they can sometimes they survive, sometimes they don't, sometimes they have minor injuries, sometimes they have severe injuries, and as the weather is getting warmer I'm in the Northeast. Um, the first nice days of spring, we see an increased number of dogs hit by cars. People are out and about, they get off leash, or they open the door and the dog runs out. And a lot of times it's not anything intentional. Sometimes 4-year-old children will open the door to go outside, and the dog sneaks out behind them, and it only takes a split second of wrong timing to have a major heartbreak. So this is kind of an introduction into the importance of training, because if you can teach your dog to come when they're called, if you can tell them to sit when they're at the door, things like that, you can't control every situation. Sometimes dogs are going to get loose or get out, but if they're properly trained, hopefully you can control the circumstance. So instead of that dog running across the street to chase a squirrel or to see the kids coming off the bus, if they'll listen to you and stick with you, hopefully they'll stay out of the road. But you see the people, Jackson, get out of the road, get over here now, or yelling at the dog, and the dog just running away and making a game out of it, because to them it is a game. They have fun and they can run fast.
And nor do they understand the phrase "get out of the road."
Exactly.
We would like to think that they do, but they really don't.
Right. Oh, the best one is, you know, when they chase after the dog, finally catch them, and then they spank them or hit them, because obviously that's never recommended, but people do that, and all you're doing is reinforcing a negative behavior. You are teaching them not to come to you when they're called by doing that. People get frustrated, but they act inappropriately, because by doing any kind of negative punishment in a situation like this, the dog is never going to come to you when they're called.
Okay, so so we're looking now at a list of things that could be prevented. Obesity, diabetes. How much diabetes are you seeing in emergency care? Is it getting to that point?
Quite a number of cases. It's for two reasons. Sometimes they'll be transferred to our facility for overnight care when the veterinarians aren't in their office during the evening, or when I see them on an emergency basis, they're sick for quite a while, losing weight over a period of weeks to months, and they finally get to the point where that weight loss and the increased drinking and urination now have become a situation where they've stopped eating, they're very dehydrated, and so often in that scenario, it's what we call diabetic ketoacidosis, which is just a severe progression of diabetes, and at that point they require generally 3 to 4 days of intensive care, hospitalization, regulating the blood sugar and everything to try to get them back on their feet again. So by the time we see them, they're often very sick.
Uh,
But it's very much like type 2 diabetes in people, all related to obesity.
we're we're going to be doing a special on dog obesity because the diabetes situation is getting out of hand. I mean, how much are
Yeah.
you seeing it? You're seeing it a lot.
Yeah, definitely.
Um, Arthritis, torn ligaments, laceration and bite wounds, hit by car. We've talked about toxicity, garbage gut. What's garbage gut?
That's when dogs run out, and again, it's related to kind of being off leash, but they'll run out and they will eat something dead or eat something out of the trash, or eat things out of the garbage, basically. That sometimes it can even be mold toxicity. There's moldy food in the garbage sometimes, and that will cause seizures in dogs and severe debilitation. When they eat something rotten out of the garbage, they can just get very sick with bloody diarrhea, vomiting. Hopefully that doesn't gross you guys out.
Well, I was actually just telling Dr. Smith the other day about my little Pomeranian Kalba who has decided that her favorite delicacy are the lizards that run outside in Florida. And I guess you would qualify that as garbage gut.
Yeah, how's that going now?
Well, we've pretty much.
Is she still eating them?
Is she still eating them? We've got a Merrick bone here for her instead, and she would rather have the bone than the lizards. Okay,
Right.
separation anxiety. Now, you see dogs emergency because of separation anxiety?
No, that I saw dogs with separation anxiety when I was in general practice a lot.
Okay, but not. And back injuries. And your dog could live 20% longer. So what makes the difference in all of these cases?
Really just these cases are all potentially related to proper training and proper care in terms of feeding appropriately. And when I say feeding appropriately, we'll talk about that because that's a big part of training and having your dog train you. So we'll get to that.
Okay, we're looking at the slide. Who am I? It's just tell me when to move to the next slide. Okay. So
okay.
Who are you?
All right. So again, as Harlan said, my name is Dr. Christopher Smith. I'm a 1992 graduate of the University of Pennsylvania. I went to University of Connecticut before that, and really this has been my lifelong passion. From the time I was 15, I started volunteering at a veterinarian's office and never stopped working in the field. Twice a week, and then at night I would work all through high school and college. I'd work weekends at the same veterinarian's office, and have done that for the past 17 years as a general practitioner, 4 years as a regular, emergency vet, and pretty much since I was a teenager. So it's my passion, and it's what I've always done.
Okay.
And it never gets boring. I switched from general practice to emergency practice because of just I love to help people. I love to help their pets and figure out complicated situations. So go ahead and move to the next slide.
Okay. So why this talk?
I think we see a lot of extreme expense, suffering, heartache in emergency practice. And a lot of these things are totally preventable, either mistakes that people make by accident or, just accidents in general. I think by improving the dog's training and understanding dogs' behavior, we can definitely help our dogs live a longer, healthier life and give us more pleasure at the same time. Imagine if all those diseases that we listed had one vaccine that could prevent all that. How many illnesses would we prevent? So let's move to the next.
Okay.
And we've all heard it. The ounce of prevention is worth a pound of cure. So that's what we're gonna work on here. Next.
Okay.
Now, one of the things that's kind of happened over the years is many dog owners have become skeptical of the need for preventative medicine, preventative care, of vaccinations, heartworm, flea prevention. And the reason is that those things have become so effective that most dog owners don't see those diseases in their lifetime. Once we get away from those things, what you see is a cropping up of things like parvovirus or heartworm if you were to stop those preventives. But I think the diseases that I see are a whole other category, and we need to start preventing those as well. And you can do it. People can do this. Does that make sense?
It sure does. Okay, today's illnesses.
All right, so I think we can probably go through this slide pretty quick. That's just a summary of the things we've already talked about. And let's get on to obesity.
We're at, okay, so which slide?
The inconvenience is correct. Actually, you're good where you are. I'm kind of following along here. Okay. So the other category of things, and these again aren't so much ones that I see, but as a general practitioner are the things that I saw. Dogs that sort of have mouthy behavior, they'll be real cute as puppies, but then sometimes when they become 110-pound German Shepherd or Rottweiler or whatever, sometimes that behavior can become dangerous, especially to little children. And so another thing that we'll see is dogs that when you try to trim their nails, they just freak out, they cry, they can get really upset. And if we can train them from an early age to tolerate those things, it can make life a lot easier. Even things like jumping up. Sometimes we dance with our dogs, and in appropriate situations, I have my own dog, jump up on me, but he knows kind of when that's okay and when it's not. Through kind of a training signal, I just tap my chest and he'll jump up, but he knows not to jump up on little children and things like that. So these are all things that you guys can learn.
Okay, now we're on training.
It's going to be a great series for every. We'll go on to the training slide. I'm not an expert trainer. You'll have a whole series of those, but I've had so much experience with dogs over the years that I hope I can help you see things from my perspective and your dog's perspective.
Okay. Obesity.
Okay. So I'm really happy that the Dogington Post is going to be doing a big big issue with obesity, and let's try to tackle this, because not only in people is it a big concern, but we're just seeing so much trouble with it in dogs and in cats too. So it is definitely the #1 health problem right now, and we need to get to the bottom of it and figure out how to prevent it.
Okay.
All right.
All right, here we go. Well, this is the story of my dog right here.
So what do you think this slide means to you, Harlan?
Well, let's see. That looks like a picture of me, and and it probably is. And there's someone next to me begging.
That's right. Dogs are very interesting. They will.
I can't believe you
remember everything.
You took that picture of me
without you knowing it.
Okay,
Dogs
well,
remember everything.
That's pretty good. That's pretty good. Yes, folks, that's me, and that is Kalba, the begging Pomeranian next to me.
He has the cutest dog ever. So dogs, as I said, dogs remember everything. That one treat that you gave them in a certain situation, they will remember that forever and will persist like you can't believe because they know that if they beg long enough, they will get another one of those treats. And so the trouble is that we think we're smarter than our furry friends, but in reality, I think they're smarter than us most of the time. And
by the way, everybody on the line who is typing in questions, we are going to get to your questions. For those of you who are still arriving, and I see more and more people are joining us, hundreds of people joining us, thank you. There will be a recording of this, and we will We will get that to you as soon as possible. Welcome, welcome. We will get to your questions at the end. Okay, back to you,
So
Doc.
when a little scrap of something falls off the table and they get to take it, or if the 12-year-old sitting at the table sneaks something underneath, they will hover forever because they know eventually if they persist long enough, they're going to get something tasty off the table. So, I know everybody wants the best for them, so you buy the best food, and but we have to be really careful because all those little tidbits. I'm actually a veterinarian that is not against table food or people food. We want our dog's food to be the highest quality possible. There are certain things that are bad for dogs, just like they're bad for us. High-fat foods, pork, things like that tend to be, a problem for dogs. But the trouble comes when all those little bits of food add up, because if your pet should be 20 pounds and you're giving them one potato chip or one piece of ham or something like that, that as a percentage is a tremendous amount of food calorie-wise. And so we have to make sure that we adapt the amount that we're giving. It's not so much what type of food they're eating, it's the amount. And to be careful of, feed the best and do the best that way. But again, just always be aware of the amount that they're getting in a day. And that's crucial. So
Okay.
let's move on to our chubby pug friend there.
Okay.
Now, the reason a lot of those diseases that we talked about earlier can be prevented is through this route right here, obesity. If we can prevent obesity, we're going to stop the onslaught of diabetics, arthritis, urinary tract infections, torn ligaments in the knees, and especially in your brachycephalic, your short-nosed breeds, breathing problems. They're more prone to heat stroke. And there's a lot of studies now that have shown that dogs that are even moderately overweight will live 20% shorter lifespans than dogs that are kept a healthy weight. And so it's a huge deal. Labrador retrievers, when they were moderately overweight, which isn't obese, just overweight, 50% of them had arthritis in their hips by 8 years of age, whereas the ones that are kept a healthy weight, only 23% had arthritis evidence in their hips at that same age. So it doubles the risk of arthritis.
And there are lots of breeds that have that issue. When Kalba was a little puppy, she was having some funky thing going on with her hip that she would start to walk funny, and I guess maybe it was because it wasn't developed. And they warned me if she gets too overweight, the hips will be a problem for her.
Huh. Yeah, we definitely don't want that. So let's go on to the next slide, please.
Okay.
So how is obesity related to training?
Right.
Dogs always act hungry because food tastes good. I mean, there's definitely some that are more food motivated than others, but if I had an offering of tasty food all day long, given treats, Reese's peanut butter cups, and all that kind of stuff, the stuff that I love, it's easy for us to pack on the weight after we hit about 30 years of age. So if you give in, your dog will be persistent, but use the fact that they are persistent in your training, and we'll get to that shortly. But you can use this to your advantage, and it's not always just a disadvantage that they remember and they're so food motivated. So let's kind of get to the number one training principle out there.
There
Unless
we
you have
are.
a question, Harlan.
No,
okay.
we're looking at the saddest thing in the world, according to Snoopy.
So whatever gets rewarded gets repeated. Remember that. Plant that into your brain. So if you want a behavior to be repeated, then reward it, and that reward can be through love, through affection, through attention, petting. Some people use the clicker training to dogs will associate clicker with treats, and then eventually you can just use the clicker. And but I'm a big fan of using tiny little treats, tiny little bits of chicken, tiny little pieces of cheese, even little Cheerios, just a little tiny reward for sitting, staying, laying down, giving paw, or whatever you can train them with. If you take, so if you, let's just talk about sit. Eventually you hold a treat in front of them and you kind of hold it over their nose and you back them up a little bit and you keep saying sit, 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 and eventually they'll actually sit even though you're not pushing their rear end to the ground if you kind of move your hand in the right way. Once they sit their rear end on the ground, you give them that tiny little treat, and then you just try to keep repeating that because they're going to want the reward. Then what happens is once they're good at sitting, then you start to just give the reward intermittently. So you give the reward every couple times they do it, then maybe every 5 times they do it. And eventually you don't even have to give the reward. But by gradually tapering it down, you have that persistence that they use in begging because, again, they remember if I beg long enough, if I stand under the table long enough, I'm eventually going to get something. So they will remember if I sit, if I sit, if I sit, eventually I'm going to get a treat. So you, again, use that to your advantage. Just make sure that you keep track of, okay, these are extra calories I'm giving my dog every day, so we don't want them to get overweight. Did I explain that okay? Does that sound okay?
That's great. So I'm going to have a question to you. If a dog, such as, let's say there was somebody from the Dogington Post who had a little Pomeranian who liked to beg and had been trained by his otherwise super cool and intelligent owner to beg, can this dog be untrained?
I think so, yes. You have to train them to do something else at that time. So can we talk about maybe dinner time and hanging under the table? Is that a good example? Or
anytime there's food, anytime there is food anywhere in the vicinity, guess who will be right there?
Oh, okay. That's going to be a tough one. What I would probably do, what I've trained my dogs to do, just as an example, during dinner time, is when I have a new dog, I will go through and teach them how to sit or lay down, and I'll have them go into the family room. Then I'll give them treats for doing that, and eventually I can get to where I can go out of the room and go back in and give them treats and reward them for laying down in the other room. Then during dinner, I actually get up and go to the other room while they're staying, and this takes several weeks to accomplish, and reward them for staying in the other room. With Kalba, and say you're sitting on the couch and you have something you're eating, and boom, she's right up on you. We may need to talk to one of your other experts about breaking that behavior, to be honest. I think what I would probably do is teach her that there's a certain place that she gets the treat, and if she'll go to that, go to your spot or whatever, then she'll get something when she goes there. But that's sort of a complicated one. I wish I could give you an easy answer there.
Okay, fantastic. Let's go to training principle number 2.
Okay.
Our dogs.
Well, that's just the training principle number 1 basically is that's the biggest thing you have to remember. It's just whatever gets rewarded gets repeated. So there's really not a whole lot other things you have to remember. If you can kind of keep remembering that, you'll be in good shape. So the next slide talks about how we treat our children versus due to the our dogs.
Persistence. We're up at persistence now.
All right. So when your dog begs and you give them a treat, well, we talked about that already. So. Okay,
let's go on.
When you overfeed, are you on difficult habit to break now?
We're on when you overfeed. Okay.
Okay.
You're rewarding bad behavior.
So,
difficult habit to break.
Yep. All right. So
guys, it's a little awkward. It's a little awkward because they wouldn't let Dr. Smith on. I guess the powers that be at the webinar said, "Oh no, you're a vet. We're not letting vets on the call." Or they just wanted to have fun with us today.
That's right. So this is sort of a review of what we've talked about already. And feeding is a pleasurable experience for everybody. A lot of senior citizens, especially, they're homebound. We see this a lot. A lot of overweight dogs have older owners, and it's something that they tend to have to be home more, they don't get around as easily, and their dog is their best friend. And it gives great pleasure for us to see our dog happy, no matter what the reason is. And one of the greatest pleasures that some people have is to feed them. And what I would suggest is try to use just affection, petting and that kind of stuff as a reward to your pet, as opposed to food. Food doesn't have to be the biggest reward. It's an easy reward, and I think that's why we use it. And it's sort of an instant gratification kind of thing. But we just always have to be aware of how much we're giving. So.
Okay. Separation anxiety.
Okay, so a lot of people have trouble with their dogs with separation anxiety, and it can be very mild, where they just kind of get nervous when you're leaving. They go crazy when you come home. Maybe they're fine when you're home. There are some dogs that are bonded to one person in the house, and when that one person is gone, maybe they won't eat well. Or I used to have a dog that he wouldn't eat or drink when I was gone. He wasn't destructive, or he wasn't whining. He wouldn't bark, but he would just not eat or drink when I wasn't home, and then he would eat when I was home. And so, some of that's okay. Each dog has their own personality, and they're definitely not different. But some of those personality traits can be made better or worse depending on how we train them and how we interact with them. So the next slide is that dogs are very smart, and their powers of observation are amazing. They observe all your cues, so your body language, they can tell how you're feeling. I mean, you all know that every day we learn more and more about how they can detect cancer, and how it's amazing. They can, if you take one bullet and put it in the middle of a football field in the ground, a dog that's been trained to sniff for firearms can find that in 30 seconds. I mean, so they read all our cues, our posture, our body language, the tone of our voice, and they react to that. They'll, if you're upset, some dogs will avoid you, some dogs will come to you, and so some of this stuff will, they feed off of us, and as a vet, it's interesting because we'll see certain dogs are hyper and agitated, and their owners tend to be the same way. And so not only do dogs look like their owners, but sometimes they act like their owners. Not always, but.
Yeah, I like that picture. Okay, so what gets rewarded?
All right. So one of the simplest ways to kind of decrease the risk of separation anxiety is, so for example, if you come home and your dog is just super excited to see you, they're manic, and we love that because nobody else in our family greets us that way, so we feel special. But by instantly rewarding the dog by giving them attention and everything, what sometimes we do is we actually encourage that behavior and that kind of frenzy for us. And so this, again, is sort of a hard thing to come to grips with, because we get pleasure from feeding dogs, but also we get pleasure from their love for us, and we want to give it back. But one of the best things you can do, actually, when you come home and your dog is real excited, is actually just to stay calm, walk in, put your things down, and let them get into a little bit calmer state of mind before then you go in and give them attention, because then what you're going to be rewarding is the calmer behavior. Sometimes the excited behavior can eventually escalate to where they do develop the separation anxiety. And by just doing that simple change, when you leave, don't make a big deal out of it. Maybe give them something to chew on when you're getting ready to go, so they're sort of distracted and actually get a reward for the time that you're getting ready to leave. But it can be a very complicated thing. I mean, animal behavior specialists will take hours just to kind of sort through what the triggers are for some of this stuff. And even if you go to get your coat or your key, some dogs will start to get real upset. So separation anxiety can be a big thing, but just with our interaction of being calm, sometimes that can help a lot.
Okay, stay calm, be strong.
Yep. So that's kind of gets to where we were talking about. I try to, when I come home, I try to stay calm. And this may sound mean, and maybe I am, but I'll actually ignore my dog a little bit for the first couple minutes when I'm home, just to let them get that excitement phase out, and then I pay attention. And some of the time, some people have trouble when they come home or when their dog gets excited. Like, for example, Cocker Spaniels are real prone to this, where they'll actually have submissive urination. They'll urinate because they get so excited, or because they actually are submissive. And this is a great strategy for them as well. Wait till they sort of calm down before you go ahead and give them attention, and then you'll have less chance of that happening.
The mother of all
right.
prevention tips.
So this, again, kind of reiterate these problems. This is one of the biggest things that I see in my practice in prevention, not only the obesity part, but now when dogs get loose, these are all the consequences when they get loose outside. So let's try to prevent dog fights, being hit by car, lacerations and puncture wounds, wildlife incidents. In my area, we actually see porcupine quills in the face from time to time. We'll even see snake bite toxicities and things like that, rattlesnakes and copperheads, and toxins as well. So this, just real brief on the next slide, how to prevent. The leash is the best thing. Obviously fenced-in yards are great. Occasionally we'll see dogs that break through those, but not only is leash walking great for your dog, but it's great for you exercise-wise. So I wanted to talk a little bit about dog fights, because sometimes people think it's people fighting their dogs, and that's not what I mean. If you want to move on to the dog fight slide.
Okay. Oh boy. Look at that. Poor baby.
This is something I see a lot too. Anywhere from 1 to 4 times a weekend, I'll see a dog come in that's has had an incident with another dog, and sometimes dogs within the same household, that all of a sudden the dynamic changes and they just go after each other. Maybe it's over some food, maybe it's over a bone, maybe it's nothing. I recently had one that the 2 dogs were laying in bed together. They've always slept in the owner's, so the owner was in bed, the 2 dogs were in the bed, and at 4 in the morning, all of a sudden they decided to go at it. So sometimes there's no specific trigger that we can see, but the dog parks, I see a lot of dogs getting in trouble there with fighting each other, and it's not always predictable. But the biggest thing is the big dog, little dog situation. Big dogs have strong mouths, and they can pick up a little dog in their mouth and shake them really easily, and those are probably the most devastating ones that we see. Little lacerations and small bite wounds can be easily treated, but when another dog grabs a small dog on the chest and punctures the chest or crushes the intestines, or those kind of things, it can be really bad. And even though you may be controlling your dog, you can't always control what other people do. And so just be alert, kind of always looking around to make sure that you feel safe and you can protect your pet.
Okay. So, hit by a car. Again, this can be devastating. There are some cases where dogs get hit by cars and they hardly have an injury at all, but and it's, I would say, very common for the door just to be opened and the dog run out into the street chasing something, and then all of a sudden they're hit. And it's, to the people, it's one of those things that we all experience where it's almost slow motion. You can see it coming, and there's nothing you can do. And so I feel real strongly about trying to train your dog to stop and come to you when they're called. So let's try to work on that, because you're never going to prevent 100% of these incidents where a dog gets out. But work on the training. Okay, toxins.
There are a lot of toxins out there that we have to worry about. Mushroom toxicity, if those are a problem in your area, antifreeze that leaks out of somebody's car. I just read that finally the antifreeze manufacturers have decided to add a bittering agent to the antifreeze to hopefully help reduce the risk of this, because it doesn't take very much at all for that to cause serious kidney damage. And sometimes by the time you know what they actually ate, unless you witnessed it, it's often too late to save their kidneys. There are a number of poisonous plants out there that we have to worry about, kind of back to the garbage thing that we talked about, and even dead rodents and squirrels and rabbits and things like that out in the yards can be a problem. And rat poison. Now that's a real interesting one, because for years the main rat poison that was on the market is one that causes internal bleeding. But it had an antidote. Vitamin K is the antidote. So as long as you treated with vitamin K, you could stop that whole process. The body would eliminate the poison, and they would be fine. The new trend is for a rat poison that actually releases a mustard gas internally in these rodents and kills them faster. The problem is that there's actually a health risk warning now to veterinary offices that if we induce vomiting in a dog that has eaten this, it can actually release a mustard gas and poison the staff members. So,
oh my gosh.
So we've actually instituted, it's not happened a lot yet, but there was a veterinary hospital in Colorado that they, I think 3 or 4 of the staff members had to be hospitalized for respiratory problems because of this mustard gas. And so it's almost like chemical warfare. And so now we've instituted a protocol that if we don't know what type of rat poison the dog ate, we are inducing vomiting outside, so that we're not in an enclosed space. The wisdom of the FDA or whoever controls that, it's amazing. And there's no antidote to that. So I just don't understand where they come up with this stuff.
Okay. Right.
All right. So
next slide.
When we talk about protecting, your dog, just do everything you can in terms of training them to walk properly on a leash, teaching them to sit, stay, and come when they're called. And you don't have to accomplish it all today. Just take one day at a time. 5 minutes of training here, 5 minutes of training there, and I think you're going to get some great tips in this series where you can fit that into your life. You don't have to take a half an hour. It's not like working out. Well, we can work out in 5 minutes too, but it's not like working out that you have to spend 45 minutes each day or 3 days a week to get this done. 5 minutes of training here, 5 minutes of training there is really all you need, and it makes a huge difference in your quality of life, your dog's quality of life. You can prevent a lot of health problems. So,
okay.
All right, let's take some questions.
Oh, questions. So, we're at the questions slide. Here we go. All right, we're going to look over at the questions, and I'm going to take your questions for Dr. Smith. Someone actually emailed in a question first. So I'm going to start with that one. And let's see. Okay. This is Michelle. She has 2 dogs and a question about each of them. She has a 5-year-old female spayed Wheaton Terrier Snickers that she's had since she was 3 months old. Has terrible anxiety when anyone leaves the house. 100 people could be there, but if one of them tries to leave, it's a nightmare. She thinks this is the Hotel California. You can check out anytime you like, but you can never leave. Within seconds, she will work herself to a frenzy. Outside of this, she knows all of her commands, but at this time, she cannot focus and doesn't hear anything. Even the most high-value treat offered during this time is ignored. It's like she's panicked. She will spin, try to grab for any limb, pant leg. If she's not in that room, she will go to the window where she can see and bang on the window. I'm afraid of her possibly hurting herself or others during this extreme stress for her. I cannot just crate her, as she from the time she was a puppy has an aversion to the crate. She will defecate and wildly bite the wires on the crate. I'm afraid she will hurt herself or break her teeth. That is, if I could even get her in the crate. How can I help her? Except for when people try to leave, she's a wonderful, obedient dog.
Wow, that's amazing. The little dog that you see on my picture, actually, I'm not sure if you have the same picture as me. Is there a little dog and then a dog laying on the grass?
No, there's a dog with a party hat on.
Okay, I actually changed the picture on my that I was going to show, but
Okay.
anyway, my dog's name is Snickers, so that's why I was bringing that up. But that's a tough one. I mean, it's a lot of people are against medication, and but sometimes there is places for it to aid as a transition in terms of anxiety. You know, people more and more, unfortunately, are relying on medication too much for their anxiety issues without actually working through the underlying problem. And I do believe in medication in some circumstances, like Prozac, as a temporary measure to kind of get you through the process of trying to resolve this. I guess I would wonder, does Snickers, can you put a leash on Snickers kind of when you anticipate this happening to try to gain some control in that way? But so that's a possibility in terms of controlling Snickers during these incidents. And then I think you have to work on where there's not a lot of people in the house and it's just a one-on-one calmer situation in terms of getting Snickers to relax even at the cues for leaving. So for example, if Snickers acts that way when you get your keys, you almost have to, there's actually a whole protocol that is probably 4 to 6 weeks long that animal behaviorists will sometimes use, animal behavior specialists, where you're literally showing no signs of leaving, and you get your dog into a calm state, you know, with treats, teach to sit or lay down, and then you get up and you pick up your keys, and then you put them back down and you go sit back down until the dog is not agitated again. And then the first day, that may be all it is. So you've actually done one step of what's associated with leaving, but then you didn't leave, or the person who's helping you didn't leave. And it really can be, it's a very time-consuming and tedious thing. Separation anxiety is one of the hardest behavioral problems probably to deal with, because how do you, once they get into that frenzy, how do you reason with them? It's very difficult. And so once you get them to relax at just picking up the keys, then you kind of have to take one step beyond that. But in between, the trouble is there are times you have to leave. You can't stay in the house the whole time, you know, for 3 or 4 weeks while this process is happening. So there is really no easy answer with that. If you can swing it expense-wise, it'd be worth seeing a veterinarian who's an animal behavior specialist, not just an animal trainer, for that type of problem, because sometimes people balk at the cost of seeing an animal behavior specialist. But when we see a sick dog, it's easy for us to do diagnostic tests and spend, you know, $300 or $400. But then we find out what's wrong and we can get them well. Sometimes the animal behavior specialist will charge $300 for a consultation, and that may seem like a crazy amount, but that actually is several hours worth of consultation and coming up with a very specific plan to Snickers' problem. They'll sometimes even have you videotape the situations that trigger, because there's so many little different things that can trigger this type of thing, and then they'll do follow-ups with you to make sure that you're making progress. So when we're talking about training, that's sort of the sit, stay, come, lay down, sit up, bark, talk, speak, all that kind of stuff. But when you get into separation anxiety, that's a whole other thing where they lose all reason, and that's what it sounds like Snickers is doing. So I wish I could give you an easy, okay, you do this and then Snickers will be fine, but it's not that easy.
Okay, let's go over to our list here and look for some of the questions that are coming in. Sharon writes, I have a senior poodle. He was a stray I rescued. When I try to groom him, he is uncontrollable. He is blind and deaf. When I try to clip him, he gets so worked up, I'm afraid he'll have a heart attack. He has heart trouble. Is there a drug I can use to calm him so I can groom him safely?
There is a drug. I would start with something called Xanax. It's very safe. Your veterinarian would have to prescribe it. There's also some more natural remedies. There's something called rescue remedy that can sometimes be helpful, and there are other calming things. But sometimes with that level of agitation, those aren't enough either. And I think you have to get to where you have somebody helping you with the grooming, and then offer, as you're just standing him on the table, offer little treats to distract him and to try to help him stay calm, and then just kind of get what you can get done in very short bursts. Once he starts to show the level of agitation, you may have to just quit for the day and then go back to it another day. Because when they're older like that, you don't want to use the sedative that could potentially cause a drop in blood pressure or other health issues. That, for years people used to use something called acepromazine, which didn't really get rid of the anxiety; it just caused sedation, and that's kind of gone out of favor in most circumstances because it doesn't get rid of the anxiety. So instead of being an anxious dog, they become a drunk anxious dog. But I think that, again, you have to take baby steps and offer really small treats like tiny little bits of cheese, and again, have somebody help you with that while you start the grooming process, and gradually work them into where they allow you to do more. Because the other option is
Lori writes.
to restrain.
Yeah.
Go ahead, sorry.
I just have so many questions. I want to see if we can get
to
more of them.
Sure.
Lori writes, what causes a dog to go to bed and vomit after eating on a regular basis, but only at home? Seems to be a habit, not out of anxiety.
That is most often caused by a food intolerance, and even if it's vomiting on an empty stomach, that's quite common. And your simplest thing there would be to switch to something like Merrick's grain-free, or one that has the limited ingredients where it's not, you want to have kind of one protein source and a carbohydrate source that he's never had before. And I would say probably 80% of the time that resolves that. Give it a try. I think it will work.
Okay. Here's a quick one. Donna rescued a mountain cur, and when she had him checked for heartworm, they said he had Lyme's disease. He was on antibiotics for 10 days. Do you need to recheck?
That's a big area of controversy and something that's always changing, but I don't feel like you need to recheck. Most dogs that are exposed to Lyme disease, their immune system actually fights it off, and what they're testing for are antibodies. They don't actually test for the bacteria. And so the current recommendation by the College of Veterinary Internal Medicine Specialists is to not retest. I would check a urine sample, though, to make sure there's no protein in the urine, because there are some dogs that get kidney disease from Lyme infections, and one of the things you look for is protein in the urine. But you don't really need to retest, and it's even debatable whether you need to treat in a dog that's not symptomatic. It'd be like if you had a cold and your immune system fought it off and you did a test for the virus that caused the cold. The antibodies are still there, but the infection is not there anymore. So you'll get different opinions based on who you ask, but most dogs that actually get infected never get sick.
Okay, Bev asks, my dog does not express her anal glands and other dogs sniff her a lot at the park. What should we do?
If she's not bothered by, if she doesn't have trouble with her anal glands, I would just leave them alone. I mean, you can have them expressed by a groomer or a veterinarian. She just may be a sexy dog that they have interest in. If she doesn't have trouble with the glands, if she's not scooting her rear end on the ground, if she's not licking back there, I would probably just leave them alone.
Okay. I'm having trouble with my puppy in house training. She goes outside, and then she comes inside. She'll go again. Bladder infection has been ruled out.
It's a puppy, did you say, Arlen?
Yeah.
I have my own technique for this, and you usually have to do it for a couple weeks and can often break this, but it does involve crate training, and so the question is, does it do it while it's in a crate or not? So again, some people are against crate training. My dogs like their crate. I don't use it much anymore because they don't misbehave, but when my recommendation there is take them out, reward them for going to the bathroom outside. When you come inside, do this for a week and see if it works.
Okay, she says
Your
she's
dog
12
should
weeks
not
old.
have any, 12 weeks old, should not have any opportunity to go off somewhere and urinate without your supervision. And so that's difficult. So what I mean is for a week, or even if you do it for 5 days, have her on a leash in the house. It can be a 12-foot leash, so but she has to stay within a 12-foot radius of you. You can tie it to your belt, you can hold it in your hand, you can have it on your wrist. If you have to cook dinner, if you have to deal with, children or whatever, the puppy should go into the crate. And then frequently, every couple hours that you're home, take her out to urinate, give her a reward for doing it outside, but then she needs to be restricted as to where she can go. You don't want her out of sight, because then she'll take that opportunity.
Okay.
A couple dogs that way, and it's really worked. Go ahead.
All right. Well, I was just going to say that we're going to take one more question, and then we're going to have a question for you, and that question is based on something that Dr. Smith said in the course of today, and the first person to type in the answer will win a wonderful gift from our friends at Merrick Pet Care. So here's our last question before we ask you one. Nicole writes in, my mini Aussie Zoe is very fearful of children. As an Aussie, she often herds them, and this scares the children. What can I do? I've had her out and about with me since 3 months, so I'm not sure where this fear is from.
Probably the best thing, again, there is to use food as your friend, again, in small amounts, and anytime you have the opportunity to have a child around who's up for it, give them a little treat, and then just have them sit on the ground so that they're non-threatening, and hold the treat in front of them, and then encourage Zoe to come up and take it out of their hand. If that doesn't work, put it in front of the child, maybe even 4 or 5 feet, so that she gets used to coming up to them and associates a reward with interacting with the children.
Okay, so thank you, folks. Here we go. The first person, now the way you answer the question is you're going to type in the answer on the right-hand side where it says questions, and we will pick the winning person and let you know. The first person to answer this question correctly receives a free voucher for a 25-pound bag of Merrick's new grain-free real Texas beef dog food. And at the same time that you win, National Mill Dog Rescue wins, because Merrick will also donate a bag in your honor. So you win, and our favorite rescue dog charity wins. And of course, you can join our friends at Merrick at the Real Food Revolution on Facebook at Merrick Pet Care. And Merrick is going to be sponsoring all of the coming webinars over the next 7 days. You are going to hear from luminaries in the pet world. And here is the question based on what Dr. Smith says. The first person who types it in gets the answer. And the question is, why are dogs always hungry? You have to answer with what Dr. Smith said. Okay, it's Nicole. And oh man, gosh, there's so many people, but Nicole was the fastest. Nicole Castillo, if you will contact us either at Facebook, message us, or at info@dogingtonpost.com. Nicole Castillo, you are our winner for the day. Congratulations to all of you who got the right answer. Oh my gosh, oh boy, so many. The answer is because food tastes good. Now, there are going to be questions every day, and everybody has a chance to win. So we will be with you tomorrow with another webinar. We hope you join us, and we will make sure that everybody can get on the call. We love you all. We want to thank Merrick Real Food for sponsoring us. Merrick Pet Care. I have to tell you, Kalba had some Merrick right before she came on, and maybe that's why she was calm during the webinar. Everybody have a great day. Thank you, Dr. Chris. We'll see you tomorrow. Bye, everyone.
Bye-bye.